with that, I would like to introduce you all to our didactic presenter, Dr. Kara Wiseman. Dr. Wiseman is an assistant professor in the Department of Public Health Sciences at the University of Virginia School of Medicine. Dr. Wiseman completed her graduate training at Virginia Commonwealth University, earning a Master's of Public Health and a PhD in epidemiology. Before heading to UVA, Dr. Wiseman was a cancer prevention fellow at the National Cancer Institute. Dr. Wiseman has been working in the field of cancer prevention for several years, and her research as a behavioral epidemiologist uses advanced quantitative methods, novel study designs, and interdisciplinary theory to develop and evaluate interventions to impact cancer prevention behaviors. To date, much of Dr. Wiseman's research is focused on tobacco cessation. However, she also has an interest in other health behaviors like alcohol use and specific populations like cancer survivors. Welcome, Dr. Wiseman. We're so excited to have you here and learn from your expertise.
Oh, thank you for that introduction. I'll get my slides shared. Hopefully I'll do it right. I did it right once. Hopefully I can do it again. We good?
Looks good.
Good to go? Okay. Thank you so much for having me today and for that introduction. As Sarah said, I'm a behavioral epidemiologist. So some of you might be wondering, what is an epidemiologist doing talking about message development? We don't usually do this kind of work. So my background is quite quantitative. And so as I've learned more about intervention development and intervention evaluation, I've been trying to find ways to use some of my quantitative training into the intervention development space. So thank you guys for having me today. I'm going to focus on an ongoing study where we have developed a text messaging intervention to address alcohol use among active duty Air Force personnel. And I'll get into them a little bit more. But before I start, I just want to thank my collaborators on this project. This is a multidisciplinary project. I work with psychologists who are active duty Air Force, also other alcohol experts at the University of Memphis, and then here at UVA, faculty and staff who help implement this study. I have no conflicts of interest. This work is supported by NIH R01. And since I'm talking about military things, I have to say my talk does not reflect any official statements of the DoD or its components. So that's a new thing for me working with the DoD. Okay, so why are we talking about alcohol misuse in the Air Force? So alcohol use is one of the leading causes of premature death among all U.S. adults. And in the Air Force and military in general, about 34% of military personnel report binge drinking. So quite a high prevalence of binge drinking. There are also kind of unique features of alcohol use in a military situation that makes us need to think a little differently about how we might intervene in this population. So for example, alcohol use can influence military readiness, which is, how able are you as your military personnel to implement your job in the military? And if it is disclosed that you have an alcohol-related issue or disorder, the stakes can be quite high. So it's including, losing your position within the Air Force and having a dishonorable discharge. So we really need to address these behaviors and be supportive, but also know that this is quite a sensitive behavior for this specific population. Age-wise too, there's a lot of underage airmen who are first starting their career. And then there are also people who are over 21 who still need to be able to be drinking within legal and non-affecting levels so that they can do their jobs appropriately. And again, the stakes can be quite high. So brief alcohol interventions are already used during this particular time called technical training, but this grant is designed to see if we can extend the impact. I don't know what the timings are, sorry. Apparently I had study timings put on, so just try to force it to do what I want. Anyway, so brief interventions could be a useful tool to reduce binge drinking in the population, but no existing text messaging interventions exist. And text messaging was chosen as a way to have high scalability, even though airmen don't have access to their phones at all time. They all have phones, so they can get text messages sent at any time, and they can be brief and low burden. But they're also already, there we go. They're also already getting a 1-session required behavioral intervention. So all airmen, when they're doing their job training, which is technical training, have a group-based intervention done within their squadron. So that's the group that they kind of work with, live with, sleep with, eat with. They do everything within their squadron. So we have a group-based intervention that's already evidence-based, and we're adding this text messaging intervention onto that, which also lets us get a little bit more tailored or personalized while still maintaining confidentiality and anonymity because of that high stakes of disclosure of alcohol use. So the purpose of what I'm going to talk about today is how we actually developed that text messaging intervention. And we had a 2-phased mixed methods study. So I'll walk you through both phases. So the first phase was an anonymous survey of 149 airmen. We, as our group of collaborative experts, created 49 messages based on psychological theory, behavior change techniques, things like that. And we asked each airman to respond also with an open-ended question of what might be a good text message that you think might discourage airmen from drinking too much during technical training. So even here, it wasn't a none message, but a reduced message prompt. And so that was our first phase. Our second phase was 283 new airmen, where we asked them to rate 77 new messages. Some were new expert messages, but others were refined messages from our open-ended question in phase 1. So it was an iterative approach. We asked people to rate the messages quantitatively using these 4 prompts, and we refined our process along the way. So the first phase, we asked people to respond to the 2 bolded prompts. So on a 5-point, strongly disagree to strongly agree scale, we asked people to respond to, this statement makes me concerned about the impact of drinking while in technical training. And then also, this statement discourages me from wanting to drink alcohol excessively. So those 2 were asked at both waves. And then the second wave, we also added the 2 non-bolded prompts, but same response options. This message makes me think about how to be successful in technical training, and this message would be useful if I wanted to reduce or limit my drinking. These messages come from a validated scale out of UNC, a UNC message testing scale, but we adapted it to fit our specific needs and our population. Obviously, it didn't ask about technical training at the UNC scale. But we do have the citation for that in the paper, which also can be put online. So each draft text message had these 4 questions asked of each one. And so we have quite a robust data set quantitatively to look at rankings of each of these text messages that we developed. We also asked basic demographic and asked age information so that we could compare responses across each of these domains of message testing for each text message that we tested. So just to give you a highlight of our sample, so in phase 1, our first phase, we had about 77% were men, and in our second phase, 67% were men, so it wasn't completely comparable gender-wise from our first to our second wave, and that's sometimes just based on the squadrons that participated in our anonymous survey, so we don't have a lot of control over who participates and doesn't. And then for age, we had about half of the sample in the first wave was less than 21, and just under half were under 21 in the second phase. And then our rates of binge drinking this is before they entered the Air Force. So, because they're not allowed to drink while they're in technical training when they first start, and then they're allowed to go off base and have more liberties as this process unfolds. So at the time they started in the Air Force, we had 11%, oh, sorry about that table, 11.5% had reported any binge drinking in the past 30 days. But in our phase 2, it was over a quarter reported any binge drinking in the last 30 days. So from phase 1, I just wanted to give a high-level overview of the top rated messages. And what we looked at was the value of ratings for those quantitative messages, but then we also did a qualitative analysis to understand what was coming up on top. So what were the key themes of our highly rated messages? So we realized that our highest rated messages fell into 3 big buckets. things that were about warnings of adverse outcomes, recommendations, and reminders of values and goals. So within warnings, within that, we also had some subcategories of highest ranked messages that were related to career implications, having impaired judgment, worry about assault, and financial costs. And so here's an example of one of our top rated messages that fell into warnings. So this is an expert drafted message that said, you should develop a plan if you drink alcohol to avoid the risk of harming your Air Force career. So we did notice that these airmen, they really had high rankings for these risk-based messages, which we thought was a little maybe not unusual, but not totally aligned with our health behavior theory, right? Like just telling someone the risks doesn't always result in behavior change, but those were what was highly ranked by the airmen. For recommendations, the highest ranked messages related to recommendations fell within 3 subcategories related to planning, moderation, and low risk drinking. So an example message for that is drinking impairs your judgment. Plan to keep your drinking under control so you won't make decisions that you later regret. That's not a super specific message about what it means to be under control, but it's working towards kind of plan to be moderate to avoid something that you might regret later. And then lastly, within the reminders of values and goals, this is to help people remember, why are you in the Air Force? What are you wanting to do with your time while you're here? And how much does alcohol work or not work in that plan? So an example highly ranked message in that domain is you want to have a successful plan for your future in the Air Force and are willing to take the time to work at making responsible decisions when it comes to drinking alcohol. So those are some examples from phase 1 of our top rated expert drafted messages. This table shows a snapshot of our airmen suggested messages, which was a really nice part of this first wave, because we got to hear from airmen's own perspective what would be a compelling message. So I won't read all of these, but we also did qualitative coding of these top example messages that we really liked from the airmen. And among these messages, 85% still had something related to a warning. Over half talked about within that a warning or a negative outcome related to a career. The rest were about impaired judgment and just consequences in general. So even when airmen are kind of proposing their own messages, they're very much risk-based messages. Some did include recommendations, and they were mostly recommendations related to prioritizing an airman's long-term goals. Some also evoked feelings of team. So as I said, these airmen, they're in squadrons, they're working together, they're living together. And if one airman has misconduct come upon them, the whole squadron sometimes can be punished as a result. So there's this feeling of kind of unity in the group that we saw come up in some of these example messages. And so these are the types of messages that we took and then refined and put into our phase 2 survey. So phase 2, we tried to get a little more sophisticated along the way. Between phase 1 and phase 2, we also learned about the behavior change technique taxonomy by Michi et al., and she's out of England. And so she has a taxonomy that really breaks down like what is the specific element of your behavior change intervention and what are you really trying to do with each aspect of your intervention. So we further refined our messages that we were testing within that taxonomy to be able to planfully consider, if we only have 20 text messages to send these people over our whole intervention, what are the best 20 and most relevant, actionable 20 that we might send. So our second wave, like I said, it was the same question prompts, and everyone was given a text message to review, but we kind of preemptively coded our text messages into these specific behavior change technique taxonomy framework. So these are the ones I pulled out specifically in our final message library. So these are intervention messages that our airmen are receiving that evoke a low risk drinking message. So we have also prevention messages as well, but these ones are offered to either all of our airmen or airmen who are over 21 who can legally drink to try and reduce the binge and the harmful drinking specifically. So we have messages related to action planning. So here's one. If you drink, eat a meal beforehand and consider having a glass of water between drinks. Before going out, think about choosing a wingman who will not drink at all and be a designated driver. If you drink tonight, don't drive, call an Uber or a Lyft. So that's not reducing drinking, but reducing potential negative impacts of drinking. Your tolerance to alcohol will probably be very low after not drinking for several weeks. Like I said, during technical training, you're not allowed to drink at the beginning. So people who did drink before will have lower tolerances when they start to drink again. So if you are going to drink, consider limiting your alcohol to 3 or less drinks. So those are some action planning messages. We also had some self-monitoring messages. If you choose to drink, partner with a wingman. So a wingman in the airman is, like your friend, your colleague. So that's a term that they use there. So partner with your wingman to keep your drink count to less than 3 per outing and 1 per hour. Behavioral substitution is also part of our message library. So interested in alcohol-free weekend, click here and the link takes them to a study-specific website that lists non-drinking activities they can do in and around where their base is, which is San Antonio and Mississippi. So there's things they can do in San Antonio that don't have alcohol. And then reducing negative emotions. So alcohol is not the only way to unwind. Many airmen enjoy doing things that do not include alcohol, like local alcohol-free activities include movies, coffee and dessert shops, trampoline parks, playing video games or sports, or visiting a museum. What might you like to do that's alcohol-free? Another reducing negative emotion messages. Technical training is challenging and it's helpful to have ways to relax and unwind. Have you ever tried tactical breathing, which is a breathing skill that they do in the Air Force already to help people unwind? And then that's a link to the actual breathing website. And also for the Uber and Lyft, we put links within our text messaging intervention to those websites to try and help them be as actionable as possible. So these are some examples of the top phase 2 low drinking messages. So I went through that pretty quickly, but we think that this is a nice example of a mixed method approach to get actual messages in front of our target population and to easily get their feedback. And we have the benefit of scale. There's a lot of airmen that come through year to year, so it's easy to get a lot of surveys completed. That might not be the case for everybody, but we tried to lean into that ability to get a lot of messages tested in a short amount of time. In both of our phases, like I've said before, the messages that were highly rated about low drinking or not, they were really focused on adverse outcomes and then reiterating values and goals. And we tried to keep that theme through in our final message library. As I said before, there's a unique context within the military. And as a result of it being highly sensitive, we actually decided not to do drink tracking within the intervention itself, which self-monitoring and tracking of drinks could be a very useful strategy. But because of the situation of the airmen, we didn't want there to be any actual record of their drinking on their personal phone. To clarify that, because they're in the military, if they have their phone, if a commander would want to see, have you been drinking? Let me see if you've been tracking your drinks. An airman would be required to disclose that drinking information. So we thought it would be best to not capture it so that we couldn't put them in any potential risk of a negative outcome by actually implementing a recommended behavior change strategy. And our intervention is now being tested in a randomized controlled trial. So we will see if we have any effect. We'll be looking at our interventions among people who didn't drink at all at baseline versus those who already had a history of drinking. We'll also be looking at our results by whether or not someone was under or over 21 at the time they entered the study. So hopefully we'll learn about what kinds of messages really resonate with which subset of our airmen. So just to conclude, this mixed method approach we thought was a really efficient way to get both direct input and new message information from our target population. Our airmen were really thoughtful with the messages, and so we thought that was a nice approach too. They were really giving us their effort by putting together some good suggested messages that then hopefully would resonate with other airmen in the future. Using this iterative testing approach was nice because we learned and refined our strategy along the way, but it's all useful data towards coming up with our final message library. And there are many dimensions that need to be considered for the final message to be the final program and the messages to be tested and developed. If you are interested in reading more about the approach, this article at the end is what is going to be shared, has our whole approach. It also has the entire message library that's being tested right now in the RCT. So if there are any messages that think that might be of use to your population or the strategy, it's all there in the article. So I think that's it. And I think my contact information is also on the website if you need it. And I know this is being recorded and there's going to be time for questions later.